So we have like one more minute, but I just wanted to make sure we didn't have any like technical issues. So I haven't done a live in a while. It's been a minute. So if you guys have any feedback for me, or if the audio is weird, I'm not mic'd up. I don't have anything fancy. I'm literally just on my iPhone in my guest bedroom with like a house full of guests who are like finishing up breakfast upstairs with kids running around and just real life. So nothing fancy, but just let me know if you guys have any problems like hearing me or typing in your questions or your comments. I know that there's a little delay too, so I can just wait to see if I need to make any adjustments. But for the most part, I just wanted to do this live because, to be honest, I didn't have time to make a YouTube video this week. It's been really hard with just juggling my kids' activities and like the holidays, and my house is like Grand Central Station with people coming in and visiting, and it's amazing and wonderful to see friends and family, but it's just a little chaotic this week. So instead of a video, I figured that I would just do a live Q&A, almost like an office hours session for you guys, so that I could answer your questions in real time, and then we'll post this so that you can refer to it later if you guys missed it, or if you have to log out or want to share it with someone who has similar questions you do. So that's what I'm doing right now. Also, I went last week to a big academic dermatology meeting in Chicago, where I learned a lot of cool new things. As far as lasers, that's kind of my area of expertise, and, in dermatology, aesthetic procedures, minimally invasive. So I'm usually the one giving the lectures in those lectures, but it was good for me to go to different, continuous medical education, lectures to just keep up to date on different things. But there's a lot of really cool things coming down the pipeline in aesthetics, things that are undergoing clinical trials and that may not be approved in the US yet, and even modalities, devices, injectables, protocols that are not even being done anywhere in the world, that are going to be coming new to us in the next couple years, or 1 or 2 years. So it was really, really cool to see what the future looks like. And that's why also I like to have this YouTube channel, to keep you guys in the know and to keep you updated in such a rapidly advancing field, because dermatology and aesthetics is always changing and always evolving, and there's always new information coming out down the pipeline. So anyways, good to see you guys. And if you guys have any questions, let me know. And thank you so much for the feedback. Yay. Hi guys. You guys are so cute. I'm glad that you guys can hear the sound, because I'm not with my AirPods or with like a mic or anything, but I can get that if needed. But we'll just sit here and chat, and I'll be able to answer your questions. So let me know. But one of the things that really stood out to me at this meeting, it was called the Asds meeting, and it's the American Society for Dermatologic Surgery, and it's mostly dermatologists and plastic surgeons. There's other specialties that have like kind of crossed over, but like the core subspecialties are like dermatology, plastic surgery, oculoplastics, and then other people who are kind of like coming over from different areas of medicine, like primary care doctors who want to open med spas and things like that. So it was interesting to collab with actually the people giving the lectures, like the true experts in our field, and hearing especially like plastic surgeons and dermatologists at the podium talking about a lot of the fear mongering that's going on in social media. For example, plastic surgeons who say that you shouldn't have Sculptra because that precludes you from having a facelift or surgery later on. There's a lot of that going on, and a lot of this like epidemic of like overfilled faces and people not wanting to do filler, which I totally understand, and going the other way, the pendulum swings the other way, and people are like not doing filler now, and they're doing more lasers or like easy gel, like more natural approaches, which as a laser specialist, that's my favorite, of course. So but it was interesting to see like the debate among experts, because for example, there is this meeting where they were talking about Sculptra before facelift, and there was a plastic surgeon there who actually gave a lecture, a very renowned plastic surgeon who is a leader in our field, and said that he actually does Sculptra on patients before his facelift because it increases collagen, and to quote him, he says it's like suturing together wet toilet paper versus cardboard. Like when there's more collagen in the skin, it holds the results better and it's easier to manipulate. And it was really interesting just to hear somebody say that, especially with most of my patients seeing on TikTok or Instagram that you can't have Sculptra, you have to have a facelift instead, and if you ever do have Sculptra, you won't be able to have a surgery in the future. So just things like that. It was really cool to hear these doctors talk and just kind of like squash a lot of this fear mongering that goes on, especially, when plastic surgeons want you in the OR doing surgery. They're not going to, recommend any non-surgical rejuvenating treatments that may buy someone time before they need to have an actual surgery. So I thought that was really cool, and I can do a YouTube video and just like take home points from that meeting, which was really, really cool. Okay, so now I'm gonna start answering your questions. Sorry, I just had to get that out of the way because I thought that was a really big take home from the meeting, in addition to all the really cool things coming down the pipeline. Okay, so someone asked, how do you find board certified dermatologists who do under eye easy gel, since most don't yet? So that's the thing. So most board certified dermatologists, just because they're board certified in dermatology doesn't mean they have a lot of, aesthetics training. A lot of them will get taught it in their didactic lectures, but not actually practice it. So I did my residency at UCLA, where like in the heart of like Westwood and West LA, we had like a ton of exposure to like aesthetics, like our first day of residency. But say you're doing a derm residency in the Midwest or somewhere where there's not a lot of, a lot of influence of aesthetics, you may not, be as skilled or trained with injections or, tear trough injections and things of that nature. So just because somebody's board certified in dermatology doesn't mean that they're an expert in aesthetics. So I would say, even if it's a nurse provider or someone, anyone, the most important thing is experience, right? So, I mean, I've been injecting almost 20 years now. So that just shows you how old I am, but it just comes with experience and training. And you don't have to be a board certified dermatologist to be an expert injector. So I would maybe, just try to find someone who is in your area. You can even search Easy Gel or just see what providers pop up when you do a search in your area, and then just kind of dig deeper. Just say like, how long have you been doing this? Where were you trained? And don't be afraid to ask questions, because if you're trusting a provider with your precious face, like they better have met the qualifications to be able to handle that responsibility. So I don't think it's a bad thing to ask, but just ask like where they trained, how long have they been doing this, and just find maybe like 3 or 4, 5 or 6 providers in your area, and just don't be afraid to go in there with like a list of questions, and don't be afraid to offend anyone or any provider, because if they're going to be injecting your face, they need to be able to answer those questions. And if not, if you get any red flag vibes, just walk out the door and don't put yourself at risk. But that would be my main bit of advice. And also you can ask, there's a lot of academic meetings that we go to, regardless if they're dermatologists, even if they're nurse providers or primary care doctors who want to get into the aesthetics field. Like the ASDS is a big one, the American Society for Dermatologic Surgery. ASLMS, the American Society for Laser Medicine, is another good one. The AAD, which is the American Academy of Dermatology, will have courses. So you want to make sure that your provider has gone through those training courses. You can look through for those on their website or in their credentials. And if they don't have that in their credentials, they probably don't have it. So that, I think experience and training is just everything. So anyway, like I told you, I've been injecting 20 years, and for my first 3 to 5 years, I was just figuring it out. It took me this long to get as good as I am now. Okay, I'm glad the audio and visual is doing well. Okay, somebody said, do you have any laser recommendations for melasma-prone skin with enlarged pores and texture? And yes, we definitely have lasers to help treat patients for large pores, fine lines, wrinkles, whatever you're wanting for your skin, but you have to use certain lasers, certain parameters, and certain aftercare to make sure that the laser treatment doesn't excite your melanocytes, which are your pigment producing cells, to make more melanin and worsen melasma. So that's the whole key to it, is knowing the parameters and what lasers are safe. And there are lasers that are safe for melasma, but you also have to adjust the settings to safely treat the skin, because you don't want someone to have this huge melasma flare when they're getting, a laser for their acne scars or their large pores. So yes, there are lasers absolutely that you can use, but more importantly than just the laser, knowing the settings and adjusting it according to what we call the endpoints is really, really important. So I can't say that enough, but most of my patients, even myself, I have melasma. Both my pregnancies, my melasma was like crazy, even when I was breastfeeding, and it just was just insane. But, so I get it. I struggle with melasma myself. But I do lasers and I just kind of keep it at bay, so you can safely do that for sure. Somebody said, do you like facial oils? If so, which to use after hydrators? So I'm not a huge fan of oil on the face. If you've watched my earlier videos, I just go into the reasons why, mainly because, you never want to, excite or stimulate the sebocytes, which are the sebaceous glands in your face. So as we get older, we get more numerous and larger sebaceous glands, and under the microscope they look like these little white fluffy clouds, but they're like full of like sebum and oil, and that's what stretches out the pores. That's what, you know, causes open comedones or blackheads. That's what increases sebaceous hyperplasia, those little annoying papules that people get on the skin. So you don't want, so oil, all my patients who are on oil and facial oil, and I stop them, usually they have shrinkage of their pores, their blackheads go away. It's great for body skin, but under the microscope, skin on the face looks a lot different than skin on the body. And so you just have to keep that in mind. And just, if you're using a facial oil out there and you're happy with it, then continue to use it. I don't want anybody to like, you know, hate on me for saying no oils on the face, but for all intents and purposes, mostly when people stop oils, they're, pores get smaller, their acne breakouts decrease, and there's more efficacious way to, you know, to stimulate collagen and hydrate the skin and reinforce the barrier than using oils. But if you do use oils on the body, I think it's good to use it first when you're fresh out of the shower, because that seals in moisture and just allows transepidermal water loss to be minimized, to keep that hydration that you received when you're in the bath or the shower, just kind of seal that in. And you'd probably want to do that first, unless you're putting on actives, and then, you know, you want to put the oil on afterwards, because anytime you put the oil on, you know, actives aren't going to be able to penetrate as easy as they do, you know, into the skin before the oil is placed. But I don't recommend facial oils on the skin, so sorry if that's going to be controversial, but that's just my opinion. And so someone asked, can I get your thoughts on finasteride and minoxidil? So I did a recent video on YouTube on this topic. I think finasteride and minoxidil, for those of you who don't know, are hair stimulating growth agents that work by different mechanisms of action. But basically, I think with both, if you want to refer to my video, I answer most of these questions. There's oral and topical forms, but I think for the right patient who is having, you know, hair loss and a widened part, or the triangular alopecia, or, you know, decreased hair density, we're seeing that a lot with GLP-1 agonists. You have to find what's right for you, but I'm a proponent of them, and it depends on, you know, the individual patient, whether oral or topical would be best. But, you know, things you have to worry about is that you can have increased hair growth in other areas, especially if it comes in contact with your skin. Orally, you can get hirsutism, or, you know, growth of, like, you know, unfortunately, like mustache hair or beard hair. So you have to be really diligent and mindful of some of the side effects that can come with it. But for most patients, depending on what type of hair loss you're having and experiencing, it could be right for you. But refer to that video, because I have a lot of information in that video. Maybe we can, I'll link it after this live is over, because I kind of give a overview of different options, because we're seeing a lot of decreased hair growth, especially with changes in hormones and GLP agonists and things like that. I've taken really good care of my skin, and I'm going to be 48 in about 3 weeks. Oh, that's my age. I'm 48. I'm having some minor neck skin loosening and smile lines, because I smile a whole lot, which is good, and they're pretty deep. So it just depends on, you know, the individual bone structure and facial anatomy, you know, what would be best. But definitely for neck skin, you know, you want to do treatments that are going to increase collagen, whether that's an energy-based device like Thermage, which I love, lasers on the skin. I mean, I've been lasering my neck since I was in my early 20s, more preventative, and actually just practicing on myself. But it's, you know, I think it's been really nice to, you know, have a more preventative, proactive approach to especially the neck and décolleté skin, which is very thin and can show the signs of aging faster because of that thin nature of the dermis and epidermis. You want to do things that are going to increase collagen and elastin, the extracellular matrix proteins that keep that area nice and thin, or sorry, nice and thick and smooth. So I would say Fraxel laser is one of my favorite lasers, just maybe once a year in the neck and décolleté, especially like starting in your, you know, you don't have to start in your 20s like I did. I was in the industry and had access, but I was practicing on myself. But I think doing, you know, in your 30s, mid 30s, and definitely in your 40s when hormones are starting to change and things like that, it's good to do like a Fraxel once a year, or if you want to up it a notch, you can even do like an Erbium or a CO2. But I think Fraxel is a good treatment for neck and décolleté skin to increase collagen over time, to keep that skin young and firm and tight. Because even if you get a neck lift, like I have a lot of patients who have a neck lift, and they look great for a year, but gravity's going to take over, and it's a matter of having collagen loss. You can pull it as tight as you want, but it's going to continue to sag and fall if you're not increasing your collagen stores, which is getting to the root of the problem. So I hope that helps. But lasers, I can't say enough. And then my neck tight serum by MDR, which I engineered mainly for like myself. So I'm like, I know what needs to be in the neck and décolleté skin to make it smooth and tight, and I want this for myself. And it's one of our, our top products because it's neck and décolleté, and it has active ingredients to stimulate collagen and elastin synthesis and that thin, delicate skin with delivery systems to get it there. But then also it has topical argireline in it, which binds the snap snare complex. And not to be too scientific, but it basically is like topical Botox for the neck and décolleté, which helps like minimize fine lines, creases, texture irregularities, and so forth. So that's that. Oh, and then for the smile lines for the face, doing things to increase collagen, like Thermage is one of my favorite for collagen banking. You can do polylactic acid, which is a biostimulatory filler, which induces the fibroblast, the collagen producing cells, to make more collagen to lift and tighten in that mechanism as well. So I'm just looking now. I have my Peloton behind me. I'm literally in my guest bedroom. So if you guys are wondering what this thing is behind me, I'm hiding because my family and friends are all upstairs being rambunctious. So hopefully you don't hear the pitter patter upstairs above me because it's pretty loud out there. Let me know, give me a thumbs up if it's doing okay, because hopefully it's not too loud. What are the top few treatments that your out-of-town patients travel to see you for? That's a great question. I would say, I think probably lasers, because it's really difficult to find a laser specialist when you really need like lasers. Like I'm talking about etched in perioral smokers lines, just one treatment, one and done to get it taken care of. Like the Erbium, the Contour TRL, I would say people fly in to see me, especially like if they're in a rural area and they haven't taken care of their skin and they're in their 60s, 70s, and have just been like, I don't want surgery, I don't want a facelift, I've never taken care of my skin, and what can I do? And literally the Contour TRL is the most amazing laser, and that's what I would say people fly in the most to see me for, because that requires such a high level of skill, and that laser is such a high performing laser that you're not going to find an abundance of that laser. But for example, when I went to the ASDS meeting in Chicago, I was in a room full of them. But we're all experts, and we're highly trained in lasers, and we're all leaders in the field. But I know a lot of them. So if you guys ever want recommendations, that's why when people say, who do I see in Virginia, or who do I see in New York, or who do I go see in Texas, I can usually refer you guys, because there's a very small amount of laser specialists who can provide that type of care. But I can hopefully send you guys to someone, may not be right in your state or right in your area, but in the vicinity, because there are those of us out there who can handle these lasers and know exactly how to use them. But I would say that, because a lot of people get apprehensive of going to their small town Medi-spa for a laser that may give them, hyperpigmentation or even worse, scarring. So I would say lasers are what people fly in to see me the most for, because that's the hardest to find an expert to treat. So let's see. Hello from Austin. Hi, love you from Germany. Oh, I'm German. Good to see you. So, and from oh my gosh, it's so nice to see all these people from all over the world. Amazing. Thank you guys for tuning in. Somebody said, is chemical sunscreen safe to use every day, particularly on the face and hands? I would say, in my training, we usually favored more mineral-based sunscreen, zinc oxide, titanium dioxide, and also if you can have iron oxide in it as well, which sometimes gives it that tint, but also protects your skin from blue light, HEV light, environmental pollutants and toxins, is the best. But chemical sunscreen definitely has its role. This may be controversial, but if, I feel like what's going to be the best is what you're going to use. So if you have a chemical sunscreen that you like, I think it's fine, to each his own. I personally prefer mineral sunscreens, but if you're going to use a chemical sunscreen, I would make sure that there is some mineral component in that sunscreen. Usually we say 7% or higher, and it doesn't have to be like 3% zinc oxide, 4% titanium dioxide to equal 7%. One of the minerals to be at least 7%, because that gives you a full UV spectrum coverage. So UVA1, UVA2, UVB, the full spectrum coverage, because sometimes people who use chemical sunscreens are only getting like tidbits or like snippets or like a piecemeal coverage of that UV spectrum. So I think chemical sunscreens are okay. from my opinion. But I would say make sure that there is a mineral in there too, because just more for just coverage. I'm watching slightly with pomegranate and castor oil. LOL. I love it. Somebody said, what do you think of Biore nose strips? Biore nose strips, be careful guys, it can cause telangiectasias, which are little broken capillaries and vessels, especially like on the corners of the ala of the nose, because you're pulling that skin. I'm not a fan of them. Most of my colleagues are not either, because it is traumatizing to the skin. So if you want to get rid of blackheads, you need to clean out the pore. So a pore can't close and tighten up if there's debris in it, right? So you want to use some type of exfoliant, mechanical or chemical exfoliant, take the gunk out, and then do something to shrink up the pore size. So use some type of like vitamin A derivative, tretinoin, retin-A, or do a Fraxel or a Clear and Brilliant, because there's a coloride of collagen around the pore. You got to shrink it tight. You got to empty it out and then shrink it tight. So I wouldn't use Biore strips, because that's just going to make telangiectasias and broken capillaries on your nose. All right, let's see. Somebody said, what do you think of Soft Wave? I never want to say anything bad about a company. I'm not the biggest fan. I've had a Soft Wave. I've had an oral therapy before, and pound for pound, having a Thermage and a Soft Wave right next to each other in the same room, treating the same patients, a Soft Wave just usually is underwhelming. Patients aren't usually satisfied. It's expensive. It could be painful. There's usually more than one treatment that's needed, so I don't usually recommend it. Again, if there's someone out there who's had an amazing Soft Wave experience, then you go with that anecdotal piece of data. But I think that Soft Wave is just not one of my favorites, just because it's very underwhelming. Thermage, always a slam dunk. Collagen Bank snatches up the jawline. I've done it 4 times in my lifetime. I'm a huge fan of it. But I'm not a big fan of Soft Wave, just because I, as a provider, and with my patients who I've, gotten feedback from, people are usually underwhelmed with the results. Somebody says, does Aquaphor have the same effect on the face as facial oil? So that's a great question. It can. Dermatologists love Aquaphor, and of course I do as well, for certain things, right? For eczematous dermatitis, for atopic dermatitis, for dry skin, winter itch. On the face, you have to be careful though, you guys. It can clog the pores, it can cause acne, it can stretch out your pore, your pore size, cause blackheads. I used to use Aquaphor under my eyes when I was a baby, when I was a teenager, because I'm like, I need to be, protective of my under eyes, and I couldn't afford, eye serums. I'd use my scholarship money for eye serums, but when I, couldn't afford it, I would use Aquaphor in it, and it, I think it helps lips, hands, under eyes, but I'd be careful about using it on your face, especially if you're acne prone, and there's much more elegant ways to hydrate the skin. So it does kind of have the same effect as oils, facial oils. Somebody said, what's your thought of using hyperdilute Radiesse to stimulate collagen in the face and tops of the hands? I wouldn't use hyperdilute Radiesse in the hands. It increases the propensity and risk for nodules, so be careful of that. Straight up Radiesse in the hands all day long. I usually do half and half. You don't want to do a full syringe, I don't think, unless it's really severe. I think it's less to do like half and half on one syringe, on split between 2 hands on one session, and then let it settle for about a month, and then come back to get a second treatment if needed. I wouldn't hyperdilute it, because studies show that it can increase your risk of nodules. And I do think that on the face, it's okay. I think there's better options than Radiesse for face. I think Radiesse, I've been doing this a really long time, and even doing things like on myself, I kind of know what products perform better than others depending on the location and the goal that you're trying to achieve. So for facial volume, I think that Sculptra is my favorite for mid-face volume loss, more than Radiesse. I love Radiesse for the hands, but not hyperdilute. You can hyperdilute it for inner arm skin, like when people have texture irregularities on the inner arms, or like in the thighs, on the abdomen. Hyperdilute Radiesse is great for that. But for mid-face, I would do Sculptra, and for hands, I would do non-hyperdilute, plain Radiesse. Hopefully that answers your question. Let's see. Okay, somebody said, I'm scheduled to get fibroblast done for my whole face, but I don't know if that's better or CO2 laser. I would go with the CO2 laser. I'm 36 and take very good care of my skin, no wrinkles, next to no fine lines. So I think definitely CO2 would be better. I just think, honestly, lasers are a very elegant way to stimulate your fibroblasts and the skin cells that produce extracellular matrix proteins to get upregulated, and nothing that really can come close to it. A lot of marketing and fancy, marketing and over promised, under delivered results from devices that try to mimic lasers or say that they're going to do the same thing as a laser does, but just been doing this after doing this a very long time, and comparing new and upcoming treatments and devices on the market. Nothing really can hold true to it, a CO2 or an erbium. And I don't care if it's like, for prejuvenation. I mean, I'm almost 50 years old, and I've been doing, CO2 under my eyes since I was, in my 30s, and a light CO2 here and there, erbium. I would do more like Fraxels when I was younger, but I'm seeing now the results paying off now that I'm older, because I was basically just practicing on myself. But I'm an example of like prejuvenation treatments, mainly using lasers, over a lifetime, and how that can benefit the skin. So if you're in your 30s, I would definitely do like a CO2. It doesn't have to be a heavy CO2 either. Like, what I think people don't understand is that lasers can be turned up and turned down. There's so many different parameters you can adjust on a laser, that makes it very customizable to each individual patient. So if you're in your 30s, you're not going to get the same fully ablative CO2 laser that someone who in their 60s is getting, or someone who's just trying to erase perioral rhytids or like smokers lines is going to get. You can titrate it up or down and change. That's the cool thing about lasers, but it takes a lot of understanding of laser physics and tissue interaction to understand how to do those settings. So a lot of doctors will be like, hey, Dr. Cabell, can I have your settings for this? Here's a picture of my patient. And I'm like, I wish it was that simple, but you really have to think like from a physiological standpoint, under the microscope, histologically, what's happening in the skin, what chromophores are we going for, how do you adjust the fluence and the spot size and the pulse width and how many passes. Like, that's just something it's the art of medicine, and that's what's the most rewarding as a laser specialist to be able to do, because it's like, I can't tell you what settings. You have to just know how to adjust and customize it to each individual patient, which is really rewarding as a laser specialist. It took 20 years of school to understand that, but it's definitely fulfilling and rewarding. But I would definitely do a CO2 to answer your question. Okay. Hi from Florida. What are your thoughts on Insta Contour Lift? Like I said, if it was a worthwhile treatment, we would be hearing about it at our meetings, and my colleagues and I would be sharing before and afters. I think it would be okay if you had a friend or you experienced it yourself and you liked it, but I think there's a lot better treatments options out there, that it makes me not able to really recommend that one as much. Someone said iodine is needed for the roots. Lots of people are deficient in iodine. So I'm assuming you're thinking like hair root, like hair follicle root. It was the first thing I took, losing more hair than usual. So iodine, I still think that, in a multivitamin, having your minerals, your magnesium, your zinc, your iron definitely, is important. Iodine, I think it could be important as well, but I think that just taking iodine probably wouldn't be my recommendation. If you guys go to, like, I'm not affiliated with Nutrafol. I don't have any paid partnerships with them or anything, but I do think that Nutrafol is a great supplement company. You have to take the supplements as scheduled for, I think you have to use it like 6 months before you start to notice results. And I believe they have customized kind of supplement lines depending on what your ailment is, like hormonal, postmenopausal, prenatal, or post, I think there's a lot of different options, and I think iodine is contained in those supplements, but I think that it's just much more than iodine. So it'd be my recommendation just to, take a multivitamin, not just the iodine itself. But if it's working for you, then I would say use it. Go for it. Proof is in the pudding, I guess. Can you reverse graying of your hair? So this is actually a controversial topic. There have been some studies showing that the melanocytes become senescent and stop making melanin in the hair root or the hair shaft. And there have been some studies showing, and one of my dear friends and colleagues has been investigating that. I think that there's not a lot of clinical trials or studies that can really support that yet, but I think we're getting close if we haven't already. But yes, that should be something coming down the pipeline soon. And just like your hair turns gray because your melanocytes, the pigment producing cells, stop making melanin, that's what happens to the skin in our face. Like our cells stop producing collagen, and they stop producing elastin, and they stop their cellular renewal, and they stop making proteins that seal in the skin barrier. So doing lasers is like a workout for your skin, or using skincare products with actives that stimulate those cells to act and behave younger, like histologically and functionally. Just start acting like you did when we were in our, in our teens and our adolescence, and make a bunch of collagen and elastin. They have to be like stimulated to do so. And so that's why, like in my line MDR, I couldn't, that's why I made my own skincare line. I'm like, I know what these cells need. They need to be upregulated. They need to be stimulated to act and behave younger. And that's what gives the beautiful results. And will kind of like undo all of the senescent cell effects that we see over a lifetime when they stop, producing collagen and elastin. And also you're breaking down collagen faster than you're making it at some point. When you're like my age, that's what happens. So you have to stimulate your skin to make that collagen and act and behave younger on a cellular level, which is like everything. Okay. Is there anything that can help lip lines in late 60s? I've never smoked. Yeah, so we used to call them smokers lines or standing cup lines, but a lot just from moving your mouth, like even like when I do it, you just get those lines etched in over time from living your life and eating and talking and, living your life, not from just smoking. And yes, I have the Contour TRL Erbium laser is a whiz. If you guys want to go to my Instagram and look at my before and afters at erasing those lines. And I've never been able to say, hey, I have a laser that can erase those lines in my 20-year career, which is pretty amazing that I can say that about the Contour TRL Erbium laser. Now, not all Erbium lasers are created equal, but the TRL is like amazing at just erasing those lip lines. Now, the downtime is gnarly, but that would be my, it's 2 weeks of, very intense aftercare and vinegar soaks and, hiding at home, but it really can erase those etched in lines, which up to that point, it also does like the texture, like texture in your chin. I'm going to have Stephanie, my amazing laser nurse specialist, do my chin just because I feel like pores on the chin are just, that's for on my face where my pores show up the most. And it just can smooth out that texture and just make it baby soft. And it can literally like smooth out those etched in deep lines on top of that solar elastosis, that skin that just looks weather beaten, So I would say that would be my answer. Of course, you can do filler, which will erase the lines also, but then you don't want to be looking like Marge Simpson. You can do it very elegantly and meticulously with the right filler and the right dermal plane and using very little, but people just overdo that, and that's why people are like walking around looking like ridiculous, and that won't happen in my office. And you can also use Botox too, for like, to decrease the orbicularis oris muscle from contracting and making those etched in lines. So that's another way you can reduce those lines. But if they're pretty severe, usually you need a laser. Now, CO2 laser will do it as well. Even Fraxel, depending on how minor they are, can help erase them too. But definitely lasers, I feel like, are the better way to go. Castor oil to help fine lines. If you want to watch my video on castor oil, I did a whole YouTube video about a year ago. I just think that that's like a lot of hype. And I know a lot of people like castor oil, but for anti-aging, there's much better ways, I think, even at a similar price point, that will help reduce fine lines and wrinkles. And castor oil can also cause breakouts and, can clog your pores. And I think for other ailments like GI stuff and other medical indications for castor oil may be beneficial, but when you're talking anti-aging, there are much better, more elegant and less less risky, not risky, but I mean, not going to break you out, not going to give you all these side effects you don't want than castor oil. Let's see. I feel like I'm missing so many. Holy Early Christmas, your MDR sale at 25% off, plus all those free skincare gifts are awesome. Thank you. Yes, you guys hop on over to the MDR website because they never go on sale. So if you guys want to take advantage of holiday sales, my MDR skincare line is doing a lot of like holiday sales and specials with a lot of good stuff that changes. So yeah, definitely check that out. Hi, is Fraxel Dual or Cyton Contour TRL laser? Ooh, I love that you know your lasers. Safe for treating the eye region for African Americans? If not, what lasers would be best for treating the eyes? Does TRL tighten? Yes, TRL tightens. And yes, Fraxel Dual and the Contour TRL laser by Cyton can be used safely, but like I said before, it's all about the settings and it's all about the parameters and it's all about the aftercare as well. one of my areas of expertise as a laser specialist was treating skin of color with lasers. And a large part of my laser fellowship training, where I had a world expert just behind my back, like asking me questions, teaching me, challenging me, and learning the intricacies of different skin types and how they react to lasers, and how you can minimize hyperpigmentation, or even worse, hypopigmentation or depigmentation, is a really important part of understanding lasers. So I want to say, yes, those lasers are effective, but you have to be very careful, and that it's all about the settings that you're using, because if you use the wrong settings with even a Fraxel dual, you can hyperpigment the skin. So for Fitzpatrick skin types 3, 4, 5, African American skin, yes, you can use it, but it has to be done a certain way, and that may vary among different patients, even with the same skin tone, depending on their skin thickness and things like that. So yes, it can be used safely with the right parameters and the right aftercare. So I hope that answers your question. How is your longevity supplement routine going? It's going well. So I did a YouTube video not too long ago because I kind of just got on, kind of wanted to revamp my supplement routine. But it's going pretty well. I do the True Niagen. I do the NAD, glutathione. I do C-Max. I the whole video explains kind of what I do for like longevity. I didn't do the methylene blue. I didn't do the rapamycin. I didn't do some of the things that I was talking about in the video, just after talking with colleagues and just kind of reading a little bit more of the medical literature, like in our medical forms, like not even ones that you like can Google, but just like in our actual like medical forms that are just for physicians only. I decided on my current routine for longevity supplements, and I can do another YouTube video on that too, but if you guys want to refer to the YouTube video that this person's talking about, yes, I've been very happy, and I do the NAD and the C-Max injections. I've been really happy with them so far, but I also supplement orally, and I take like my my Safe Cell and my True Niagen, which I really like a lot, and most of the other supplements that I talked in that video. But so far so good. I mean, I don't really feel any different, but I didn't have any symptoms to correct anyway. I didn't really have any like fatigue or brain fog or any symptoms, so I haven't really noticed an increase in my energy. I'm always pretty full energy anyway, and I drink coffee, so I think to keep up with my kids, but I've been really happy with it. So I think it's just a good thing to do, and just something that I kind of wanted to try out, but it's going really well so far. And I haven't really gotten my IVs, but I do take the supplements and the subcutaneous injections for those two supplements. So far so good. Somebody said, if you could only narrow down to 3 skincare products, what would you use? Okay. For sure, I would use a sunscreen. That's a must. I would definitely use probably a vitamin C and a retinol, some type of vitamin A derivative. If I had to pick 2 other ones, it would be an eye serum and a hydrator that reinforces the barrier, but definitely I would do vitamin C, a retinol, and a sunscreen. I think that, of course, using sunscreen is one of the best things you can do over a lifetime. Face, neck, chest, backs of the hands, all the things. But I think a vitamin C is really great for antioxidant, to help reverse any skin damage that has taken place, and also to prevent it from happening in the future. Free radical scavengers, of course, are important, but to find a good vitamin C is so important, you guys. That's why my vitamin CFK is, I wanted to engineer that, because there was not a good vitamin C on the market that would actually penetrate the skin, get to where it needs to go, and then have an effect. Either they sit on the surface of the skin and do nothing. They feel nice because your hands are feeling it, but it's not penetrating into the epidermis, in the dermis where it needs to go to actually have an action. And then also, it has to be in an airtight nitrogen lined chamber to maintain the efficacy of the vitamin C. So make sure that it's not in a dropper. Make sure that it's actually getting into the skin and doing what it needs to do. Now, how do you assess that? In our lab, when we're engineering our products, we're looking at skin biopsies and looking under the microscope and doing testing to make sure that it is doing what it needs to do and having the effects of the skin histologically. But if you're using it and you're not seeing a difference, that's how you know it's not getting where it needs to go or doing what it needs to do. So I think that if you're using something and within like 2 to 3 weeks, if you don't notice an improvement in your melasma or a reduction in your acne or anti-aging effects, your skin's brighter, firmer, tighter, you need to toss it and try something new. For a retinol, I think retinols can be tricky, because retinol, can irritate the skin and not even have an effect. So you want your retinol to get inside of the cell. So that's why a microencapsulated vehicle delivery system like my RXR retinol is really important, because it gets into the cell to have an effect, increase collagen production, elastin synthesis, cellular renewal, reinforcing the barrier, all of the things. But a lot of times retinols just sit outside the cells in the space that we call the extracellular matrix. And what it does is it recruits a bunch of inflammatory cells to come in, and then that causes, the red dry peely effect. So you're getting these side effects because it's not even inside the cell, and it's causing you red dry peely effects, and you're not even getting like the benefit of using a retinol. So you should see results after using a retinol, and if you don't, again, time to toss it and just get one that will give you the effects and minimize that irritation, because just because you're getting irritation doesn't mean that you're getting the benefits of it too. And then make sure you're wearing a sunscreen. That was a very long answer to your question, but I got excited when it comes to skincare. Let's say, who do you recommend in Minnesota or Wisconsin? I don't know anybody in those areas, unfortunately. I'm sorry. Usually, you can actually just like comment in the comments and I'll respond to you, but it's hard to find, sometimes in like a state specific in a more rural area, but usually there's, a state that's adjacent that will have an expert when it comes to lasers or aesthetics, and I can hopefully help you find that. Because you guys are like my babies. I want to protect you. That's why I do these YouTube videos. I literally like want to empower you guys and show you guys, or kind of open your eyes or open, the communication to experts who can take care of you, instead of just having you have some bad result or something bad happen to you when you go to like a local medi spa, because that happens way too often. So hopefully by following me, you'll, have the tools and the education to make you, foolproof to where you're not having, bad things happen to you, or you don't get taken for a ride for, something bad. Let me see. Hi, thank you so much for doing this live for us. I'm curious about your thoughts on the QS01 peptide one skin. Worth incorporating into your skincare routine. Just because there's not a lot of data supporting it, I'm an evidence-based provider, and I can't recommend something without, a lot of data or research supporting it. So I cannot recommend that to you. But maybe I can get more information for you on that. But as of right now, I wouldn't recommend it. I don't have anything bad to say about it, but again, being evidence-based and a woman of science, I can't really recommend that one. Yes, how do we get your recommendations for a specialist? Do we call your office or ask online? Just when, I usually do videos where I tell you guys what to look for in credentials. You guys will know the red flags. If you get red flag vibes, or, somebody's not posting their credentials on a website, they're not doing it for a reason. They probably don't have them. So it's not like I'm going to, we are few and far between. And again, when we go to these meetings, there's maybe 50 to 100 of us in the room, and we're scattered among, New York, LA, Miami, Texas. There's some in, DC, so Virginia, but I'm not every state has a world-renowned laser expert in their vicinity, unfortunately. Contralateral expert in Houston. I don't know if Dr. Friedman is a laser expert in Houston. I'm sure he probably has a contralateral. If he doesn't, he has another equivalent laser. He's highly trained, so that's where I'd go to if you are in Texas. Hello from the Netherlands. Hi, it's so good to see you guys. Oh my gosh, I love our worldwide participation here. Hi, Netherlands lady. My family is there. Oh, I love it. You guys are talking to each other. Oh my gosh, I'm missing so many of these, you guys. I'm so sorry. How much collagen can I actually produce at age 74? This is a great question, and you can produce collagen at age 74. Now, it may not be someone who's 24 at that rate, but you'd be surprised, and I don't want my more mature beauties to think like, I'm postmenopausal, I can't stimulate collagen. We do it every day, all day. It's like going to the gym and working out your muscles, getting sore, drinking your protein, and building muscle. I mean, any organ system, and the skin is no different. If you stimulate it and give it the nutrients it needs, it will upregulate the activity and physiologic function that it had before. Now, of course, it's not going to pump out as much collagen as my daughter, Riley, who's 11 years old. I just look at her cheeks and I'm like, oh, there's so much collagen. I just love your skin's upregulation of collagen synthesis. That's what I think when I look at my kids. But I know it's weird. But you definitely can upregulate collagen synthesis in your 70s. Lasers, energy-based devices, skincare actives. So if you look at a 74, and I've done this before, and because I was a Mohs skin cancer surgeon for decades, and I would look at skin under the microscope, and I would look at my Mohs micrographic surgery patients, which are skin cancer patients, under the microscope, and I'm like, this 70-year-old 4 years ago when I did Mohs on her didn't have as much collagen as she has now at 75. Like, what happened? What was different? And I would you look through her chart, and of course she'd done a Fraxel, or she had done, a Thermage, or she started using tretinoin. So you definitely can activate collagen synthesis regulation no matter what age you are. Skin is going to respond to stimuli just like muscles are going to respond at the gym to lifting heavy weights and drinking your protein. So definitely that's an important point. Would you recommend to hold off on treatments for jowls and technique for someone who's in their 50s or someone who has 50 pounds to lose at 45? So that's a great question, and I've actually investigated this and looked into the research behind it. So people who are having a dramatic weight loss over a short amount of time, I have a lot of patients who are on their weight loss journey, and they come to see me and they're like, do I just wait until I'm at my new weight? And the answer is no. It's kind of like if you can do, collagen stimulating treatments and rejuvenating treatments as you're on your weight loss journey, it is much better than just letting it totally go and trying to reverse it later. It's like, prejuvenation treatments when you're younger. Doing baby Botox and lasers once a year, using skincare actives in your 20s, 30s, and 40s puts you in a better situation in your 50s, and if you just trashed your skin and not paid attention to your skin, you neglected it, and now you're trying to rewind the clock. It's a lot easier to maintain and adjust as you're losing that weight, like pregnancy. So as you're pregnant, your skin's constantly adjusting to that rapid expansion and stretching out of your skin. Then if you just were to go from day one to being 9 months pregnant, I mean, your skin would deteriorate, and you'd have elastin, breakdown and stretch marks. I know we get stretch marks anyways, but your skin has to have time to adapt. So if you're losing volume because you're losing weight, for example, on your face, don't let the jowls form and then try to treat it later. Like as you're losing weight and you're upregulating your collagen to make up for it, and then you lose more weight, but then you're stimulating doing that. The human body and the organ systems love recalibrating and readjusting and balancing. It's all just a process that makes the organ systems, the body, the skin healthier. It's not like losing a bunch of weight and then reversing it later is usually not the way to go. So I would wait, and as you're losing the weight, keep recalibrating and stimulating your skin cells to keep up with the loss of volume, especially in your face. Now, whether that's increasing collagen stores, you're going to lose fat as well. And of course, there's ways to add volume without doing a fat transfer, but adding volume to make up for the fact that you're losing volume, I think, gives a more natural looking result and will keep you looking like you more in a more stable manner than just not caring about it and then trying to reverse the damage later. Okay, somebody said, hi, I'm a nurse. How can I become an esthetician or an aesthetic nurse? What training do you look for when hiring? I think that's the hardest part about nursing school is that, or being a nurse provider or a nurse injector, because usually derm residency or fellowship, we can do fellowships to learn aesthetics, but I think in the nursing world there's not a lot of that out there. So I think getting experience is really, really important. Like Stephanie, my amazing laser nurse, has been with me for almost 15 years and was doing lasers with me, and she actually went through my training with me, but as assisting me, and then she's like, I want to go to nursing school and do this on my own, and she knows more about lasers. Steph, I'm talking about you, I don't think you're on here right now, but she knows more about lasers than most of the dermatologists that I know. So I think and training experience is really important. Going to the ASDS, the American Society for Dermatologic Surgery, is great. Palette is another great training program. ASLMS has training programs. The American Academy of Dermatology has great nurse training programs for aesthetics. Doing that and investing in your education and your skill set and your training is so important. And if you really want to be, a provider and do aesthetics, that is what you need to do. Now, I've even had, and so if I was looking for, to hire, someone to do aesthetics in my office, I would make sure that they had the background check, the education, the training that would enable them to have the honor of treating my patients, because it is an honor and it is a responsibility. But I think a lot of, especially sometimes younger nursing students, they'll come out and be like, I don't want to spend like 6 months in a training program, or I don't want to spend $2,000 for this training course. I'm like, you should be spending 20 years doing it. And just, our education, was our payment when we were in fellowship and residency. You get paid nothing when you're in, 4 or 5 years of training, but your education is your payment. So I think investing in your education is really important, because a lot of people want to just open a med spa, but they complain about doing 2 months of like a training session, where I think you should do years. Like, I think, you should have, as much training as possible, and dedicate that time and money and investment, because you're not only investing in yourself as your provider, but you're going to be taking that much better care of your patients, and you're going to be that much more skilled as a provider once you invest in yourself and your education. I know it's expensive, and I know it takes a lot of time. It took 15 years for me. I'm not expecting other people to do that, but I think you definitely have to like take the time, carve out that time in your life before having kids, or when you get married, or wherever that time fits into your life. Put that time in, because it will pay off dividends when you're older in your practice, because you have that skill set, and your patients will have better results and be more comfortable with you, and you will feel that you have you're worthy of that honor of treating your patients. So so look into those programs, because I think it's really, really important. And I just, sometimes I get frustrated when I have patients saying, I really want to be, a nurse injector, but I don't want to, pay the $2,000 for the training program, or I don't want to spend 2 months learning how to do this. I think you should be spending years, and even more than that, really, if you really want to be an astute provider. I'm very protective of my patients, though, so that's just me. I'm sure you'll find someone else who's hiring after just YouTubing how to do injectables and find a job. But that's the problem with aesthetics today. There's no regulation out there. There's no board certification that you have to take to perform these procedures. There's no accountability or regulation out there, but people are getting hurt, and people are having horrible outcomes, and med spas are getting shut down, and people are having complications. So I'm really passionate about that. Okay, yes, I would like Yes, I would like perimenopause advice too. Oh, my skin is dry and more coarse hair on my legs. Very annoying. Yes, that is very annoying. And during perimenopause and, the postmenopausal period, our skin changes. And so you get dry, you get flaky, you get itchy, because your barrier is impaired, and, your skin cells aren't renewing themselves like they did before. So I feel like for perimenopause, hydration and barrier restoration is really, really important. So, like my intense NMF hydrator is like a mask that you could, not a mask, but it's like a thicker cream that, like, even for me, like when it's, cold and dry outside, if I put on my face, neck, chest, I wake up and it's just like baby soft skin, where when I went to bed, it was dry, itchy, flaky skin, and you want to restore the barrier. So I think that barrier restorative creams are really important in the perimenopause period. Things to upregulate collagen without over drying and sensitizing your skin are really important. And then also, and you don't have to spend a lot of money. If you get like some type of alpha hydroxy, there's kids running around. Sorry, you guys. I don't know if you hear that. I apologize. It's the holidays. If you get like amlactin, like Target or CVS, it has ammonium lactate in it, and it helps. Urea is another good active that you can look for, just like CVS. Drugstore brands that are going to help stimulate a little bit of exfoliation while also hydrating the skin and reinforcing the barrier. And that's going to plump and tighten up the skin, and it's going to make the skin more hydrated at a cellular level, so it's not red, dry, flaky, itchy. So that's my best advice. So somebody says, hello, doctor. What kind of non-invasive treatments do you recommend for girls older than 55? So definitely, minimally invasive treatments. I think it depends on what you're looking for. For anti-aging, to lift, tighten, and pull, I love Thermage. I think Thermage is one of my favorite treatments for stimulating collagen even after the age of 55, to help lift and just contour, smooth out that neckline, tighten up the neck skin. Lasers are also really, really great. Again, we can induce collagen synthesis and smoothing and tightening of the skin at any age, because they're cells in our body, and they may slow down because they become senescent with age, but you can stimulate them to work like they did decades before when you were younger. So I would say non-invasive treatments would be energy-based devices, and I think lasers for sure would be my. Now sometimes people will get a little bit more adipose tissue, especially like in this area when they're older, because of the accumulation and the redistribution of the fat is really weird after menopause too, because our hormones change and we hold on to fat in areas where we didn't have before, like above the knee, back fat, bra fat, underarm fat, and like especially right here, Kybella is a great non-invasive or minimally invasive injectable to dissolve fat. We do that a lot here, especially in the midsection above the knees. I think those are one of the best treatments for patients older than my kids are running around. I'm so sorry, guys. Hopefully you guys give me a thumbs up or thumbs down if you hear that they're like screaming and running around, and I think they're playing soccer in the upstairs. But it's real life. Here we are. But I think that's really important, especially for like fat redistribution when you're in the postmenopausal period too. And then also, I think like we've been getting such great results. I think Volux in the jawline is so underrated, you guys. I don't know if you've seen me on Instagram. I post this a lot. Volux, it is a filler. So I know people are kind of shying away from fillers these days, but when fillers are placed in the right dermal plane and the right product is used, there is nothing like it. So Volux in the jawline, I think for my 55 and older patients has been a game changer in our office, because a lot of people don't want to have surgery or have a facelift, but they lose that, their skin is laxed down here and they lose that jawline definition and contour. And what Volux does is it's an injectable that gives that jawline structure back, because we lose our bone, like we lose our bony structure of our jawline. Just like we get osteopenia and osteoporosis, the bone starts to disintegrate and your face and neck becomes blended into one cosmetic subunit and you lose that definition. So doing Volux not only contours that out, it lifts up the lax skin that was previously being held up by that mechanical suspension, and it just tightens up the skin, it accentuates the jawline, and it makes the jawline not blend into like your face and your neck just looking like one big blob. That happens to us during menopause. It's a sad but known truth, and replacing that lost jawbone can have like a lot of really beautiful aesthetic effects, because you're basically fixing the problem. You're replacing something that's been lost, and then that gets you back to where you were before without making you look someone that's not like yourself. So I think that's one of the most underrated treatments I do for my beauties who are 55 and older. Somebody said I love you, Dr. Stephanie. I love you guys back. I love you guys. Thank you so much for your support. Okay, so I'm just gonna end it with one more because we're coming up on an hour here pretty soon. Somebody said, does collagen with peptides in your coffee help facial collagen? Yes, I think it does. I just had some in my coffee this morning. I use the Vital Proteins collagen peptides, but I think that if they're bioavailable, yes, it can definitely help with your skin. Now, your skin has to be upregulated to absorb the building blocks of collagen, because what happens is sometimes, collagen, when you ingest collagen in your diet, whether it's in a supplement, in your coffee, a powder, your skin isn't the only organ system that takes up that collagen. Your eyes, your skin, your bone, your teeth, your tendons, other areas will upregulate it too, or uptake it too. So sometimes, like especially after a laser treatment or thermage, I'll have my patients use their collagen peptides, usually in their smoothie, their tea, or the coffee. You don't want it too hot because it can denature the proteins. But once you have that and your skin's upregulated, it will take it out from the bloodstream. So it has to be bioavailable, which means it has to be ingested and put into the bloodstream. And then after it's in the bloodstream, there has to be signals that are going to uptake it into the epidermis, the keratinocytes, the fibroblasts, all the skin cells that need those collagen building blocks to make new collagen. Because you don't want to take a bunch of collagen peptides and have it go to like your bone in your big toe. I mean, that wouldn't be a bad thing either, but you can't tell the collagen peptide building blocks where to go. So you have to just do treatments that are going to upregulate them. Even if it doesn't have to be a treatment. It could be a skincare active. Say you're using your retinol or your tretinoin and you're taking your collagen peptides. That's creating a sink and a source. And like we say in medicine, a sink is you want it to be pulled into that area or that organ system, and the source is going to be getting it from your diet. So I have to try not to be too scientific when I talk to you guys, but I think you guys understand it and you get it. Okay, I promise that this is going to be the last question. Okay, somebody said, I've done Fraxel and Pico in the past, but I'm considering CO2 for stronger collagen remodeling. Is it appropriate even if my skin is healthy? So yeah, I mean, it all depends on if your skin's healthy and you're doing it just to like be proactive and to collagen bank and to be biostimulatory. We're not going to have to do like a hardcore CO2 like we would if you had etched in lip lines or acne scars that we're trying to resurface and erase. It would be a lighter setting, and I probably would do like a fractionated instead of a full field CO2 treatment. Like the CO2 a fractionated CO2 that I have in my office is one of my favorite lasers because it's fractionated, which means it should be treating a fraction of the skin. There's like little, zones of treatment that we're treating that makes it faster, quicker downtime, quicker recovery, but it still does a lot. You don't have to do the full field CO2 with these strong settings that you would have to do, like, for scarring or for, erasing lines and more severe cases. But definitely I would do it. Like I said, I've been doing CO2 under my eyes since I was, gosh, in